Welcome back to the She Found Motherhood podcast. Today, Alicia and I are going to talk all about preparing for breastfeeding with antenatal hand expression. We'll talk about what hand expression is, why it's important. We'll even talk about the breast changes that your body undergoes in pregnancy and understand what colostrum is and why you want to use it. We'll get into all of this and more after this quick message. Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it.
So we've talked about this a lot on our social media feed, so we thought it was about time that we did a podcast about antenatal hand expression, otherwise known as expressing milk while you're still pregnant. But we thought before we dive into what antenatal hand expression is and what its benefits are, we thought we'd briefly talk about the changes your body undergoes in pregnancy, and more specifically, the changes your breasts undergo.
If you're currently pregnant, you may have noticed that your breasts have already undergone some changes. The medical term for this is mammogenesis, and is caused by the rise in estrogen increasing the blood flow to the breasts as well as causing the ductal system to grow and transform. The hormone prolactin causes the nipple to grow and the areola, which is the darker skin around the nipple, to grow, and that's due to the serum placental lactogen. Ooh, lots of hormones.
Fancy words, so many hormones.
Who would have thunk it?
Right?
All these changes start in early pregnancy. And while the next step, lactogenesis, which is the beginning of the transition to producing milk, doesn't typically start until later in pregnancy, which is why some people who are pregnant, whose babies are born very, very preterm, may have a lot more difficulty with milk supply and lactation than those born close to or at term.
So after, the process of mammogenesis, the next step in your lactation journey is called lactogenesis 1. And as we mentioned above, this typically begins mid to later pregnancy, so 16 weeks and onwards. Some people start early, some people start later. So that's okay if you're in your mid-trimester and you're still not noticing any colostrum. It's quite normal, in fact. So we often start to see colostrum beginning to form in the breasts anywhere from the second trimester onwards. But again, some people it doesn't start till the third trimester, and that's okay. Now, if you're not sure what colostrum is, don't worry, we'll get to that later. So you might ask, if we start making colostrum in pregnancy, why don't we make more milk in pregnancy? And the reason for this is that progesterone that's produced by the placenta, so the progestation hormone, actually interferes with the prolactin receptors, and that inhibits your body from making a significant amount of milk.
So when do we start making milk? Well, this next state in the journey is called lactogenesis 2, and it's triggered by the delivery of the placenta, which results in a huge drop in your levels of estrogen and specifically progesterone. And as a result, prolactin, the prolactation hormone, is no longer blocked and is now able to send the message to your breasts to make milk. Now, although this begins immediately after the placenta is delivered, it's important to understand that significant milk production doesn't typically begin until 3 to 5 days after birth. This is commonly referred to as your quote-unquote milk coming in.
Now, we've been talking a lot about hormones, and everyone loves to talk about hormones, but it can be confusing. So it's important to understand that this beginning stage of milk production, so mammogenesis and lactogenesis 1 and 2, is under what we call endocrine control. What on earth does that mean? It means that this happens even without an infant latching and suckling on the breast. So for those who, for whatever reason, have chosen not to breastfeed, you'll need to talk to your provider about strategies to slow production and relieve engorgement. And although milk production starts out as an automatic or endocrine, hormonal-related process in your body, the transition to lactogenesis 3, or ongoing milk maintenance and production, requires ongoing stimulation of the breast and nipple and adequate and frequent effective milk removal. That can be either from infant feeding directly, hand expression, or pumping. Okay, so now we understand the changes your breasts undergo. And so by 36 weeks, generally speaking, your body should be making colostrum. And now is the time, after confirming with your maternity care provider, that you can begin to practice hand expression.
So, what is hand expression exactly? Well, it's literally using your hands to compress and massage your breast tissue to express colostrum and collect it to save for your newborn. Doing it antenatally or while you're still pregnant before delivery helps you get comfortable with hand expression and also helps you build up a little bit of a stash of colostrum that you can use to supplement your newborn in those first few days if necessary. So, first things first, confirm with your provider. If you're at risk of preterm delivery or you have another reason we would not want you to have labor, for example, placenta previa, and if you don't know what that is, go check out our podcast on
Mhm.
that. It may not be recommended for you to practice hand expression. Your provider will let you know if it's safe to hand express. And that's because that nipple stimulation can sometimes get you cramping or kick you into labor. So we generally recommend waiting until about 36 or 37 weeks in case it does trigger contractions. If you're experiencing any cramping or contractions while expressing, we advise you to stop immediately and contact your care provider, especially if you're preterm. You might want to experience some
Yes.
mild contractions at 38, 39,
Yes.
40, 41 weeks if you haven't had a
Yes.
baby yet.
Yes.
But certainly if you're starting at 36 weeks and at 36 or 37 weeks you're having cramping with it, please just hold off until you're a little bit closer to your due date to do this. Now, you want to practice hand expression for several minutes a day, and Sarah's done a great Instagram reel on hand expression to learn the technique. You can collect the expressed colostrum in a syringe, or if you go to public health in our community in Victoria, they'll actually give you these little.
Oh, I didn't.
Yeah, they'll give you these little storage containers that you can use it and then freeze it, and then just bring it to the hospital with you for when you have your baby in a little cooler.
So, generally speaking, if you're not on social media, but you still want a visual, we'll try and talk you through it. So, the first step is to clean and wash your hands and any collection equipment that you might use, like a cup, a spoon, or syringe, or if you're here in Victoria and probably other communities, go to public health and they'll give you these special little collection cups. So, what you want to do is begin by massaging your breast gently, and this can help stimulate the milk ejection reflex. You do so by just applying a little bit of gentle pressure using the pads of your fingers in a circular motion and moving around the breast. Then you make a C shape with your thumb and index finger and place it on your breast with your thumb and your index finger about 1 centimeter above and below your areola, that darker skin that's around your nipple. Then you're going to push your hand a little bit towards the chest wall and then gently squeeze the breast, rolling your hand from the chest towards the nipple. Now, don't be discouraged if you don't immediately have colostrum, but practice it for a few minutes at a time. It may help to be warm and relaxed, so some people begin by practicing it in the bath or the shower. A few other key pointers is to express from one breast at a time. When you're learning to do this, don't try to do both at once. Just focus on one breast at a time and just for several minutes. Again, if you're wanting to save colostrum, and we're going to share the benefits of why you'd want to do that below, we recommend getting some syringes in advance. You can get them from public health, or you might be able to even order them off Amazon. We have some good options that we can link in the show notes. As like Alicia said, you can freeze the colostrum and transport it to the hospital.
And like any skill, it takes a little bit
Yeah.
of practice, which is why it's so important to start practicing it before your baby is here. Because once your baby comes, they're sweet and lovely, but they don't
Yeah.
sleep
No.
and you have no idea what to do with them.
No.
And they're crying and hungry. And so if you've practiced that skill, you're going to be much more confident in yourself and your ability to get your baby some colostrum, even if they're not doing great at latching yet. Because again, that's another skill that needs a lot of
Yes.
practice to
Yes.
get down. So those first few days after having your baby, if you've never breastfed before, your baby's never breastfed before, it takes work to get there, and that's normal and that's okay. So practice the skill beforehand. And then if you have some saved colostrum, you can give that to your baby if they're starving Marvin.
Totally. And it can calm them down.
Yeah. And then give them the
Mhm.
patience to actually work
Learn.
on learning a latch with
Mhm.
you.
Absolutely.
Okay, so we've chatted a little bit about the changes that your breasts undergo during pregnancy and the logistics behind hand expression. And I just want to note, none of Sarah's talking you through that skill actually had you squeezing your nipple. It's not nipple
Yes.
expression. breast expression.
Yeah.
You're trying to squeeze the milk out of the ducts towards the nipple, right?
Yeah.
So you're not. This
No.
is actually not stimulating your nipples, which is one of the things that can get you into labor. So
Yeah.
most people do okay with this, and they
Yeah.
don't get any of the
Yeah.
cramping.
Is this pain I'm feeling in my pelvis normal? Should I do genetic testing for chromosomal differences in my baby? Is it safe to go to the dentist while I'm pregnant? Doctors and maternity specialists Sarah and Alicia are here to empower you with even more knowledge so you can have the best pregnancy, birth, and postpartum experience you can. Presenting the Pregnancy to Parenthood podcast, a new series of informative episodes geared week by week toward whatever trimester of pregnancy you're in. Tune in weekly, following along relevant topics as you move through pregnancy, or just binge listen and come back to the episodes you found most helpful. Access the full series for a full 2 years and listen to it on your own time. To learn more, go to www.shefoundhealth.ca or click the link below.
So let's talk about why you might be interested in doing this and why we recommend kind of hand expression before you even have your baby. And part of that is understanding what colostrum actually is. So colostrum is this magical substance.
Liquid gold, right?
So it's early and it's super concentrated, full of nutrients, and has a lot of really important immunologic properties that are tailored towards your newborn. Not any newborn, but your specifically.
baby. It's so cool.
It's so cool. Our bodies change the breast milk we produce based on what our babies need throughout the breastfeeding journey. So it's really quite fascinating. And the colostrum provides everything your baby needs in those first few days after birth. A lot of people get really anxious that their babies aren't getting enough and they want to supplement with formula but your baby's bodies are not meant for that. They're meant for using your colostrum.
And small amounts.
And small amounts, like super frequently. But that's what helps one, get the latch established, and two, gets the breast milk kind of flowing.
Effective and frequent breast emptying.
Yeah, but it can be exhausting. We're not saying it's not exhausting.
Yeah.
So it's also higher in concentration in both proteins and minerals and lower in carbohydrates, fats, and vitamins. It has a high amount of immune and growth factors, and it really starts to help activate the immune system and get that healthy gut microbiome going.
Oh, yeah.
Which is so important.
That's another really hot.
Yeah, we're trying to get Dr. Karina Saunders to do a podcast.
Yes. Oh, I got to follow up with her.
I sure do, buddy.
Okay. So now we know how your body makes it and we know what it is, but why bother saving it? Won't I be able to just latch my baby and feed them directly from the breast, you might ask? In many cases, you can, but that's not always the case. Like we've outlined above, breastfeeding is a journey and it's learning. So if you know us by now, you know that we really like to prepare you for what to expect during your pregnancy to parenthood journey. And having breastfeeding struggles and challenges is much more common than you might realize. So it is great to have a stash of colostrum on hand. Now, we're going to share a few specific instances why you might want to come to the hospital prepared with colostrum. And this includes the following that we're going to talk about, but is by no means exclusive. So for starters, if you're having a scheduled cesarean section or planned induction, we know that sometimes there can be a delay in your milk coming in because your body isn't naturally undergoing all those hormonal changes leading up to labor. So having a stash of colostrum and the skills of hand expression in your toolkit can be really empowering in those first few days as you wait for your milk to come in.
For pregnant people with diabetes in pregnancy, so whether it's type 1, type 2, or type 3.
Oh, gestational. I made it up.
Gestational diabetes.
There's no such thing as type 3, guys. I wrote this podcast when I was very tired, clearly.
Your babies are at a higher risk of having low blood sugars after birth, as they're used to having higher blood sugar loads from you than is kind of typical in the average pregnant person. So they also often need some extra calories just to maintain their blood sugars at a safe level. So having some colostrum can really help baby to maintain their blood sugar levels. And they may require additional nutrition in the form of glucose gel or formula as well. But hopefully, if you have a bit of a stash of colostrum and then you're working on kind of feeding your baby, breastfeeding, or kind of pumping or hand expressing in the hospital and giving them that as well, you should be able to kind of hopefully get them through those first few hours to days as their bodies are starting to regulate their own blood sugars.
So one of the most common reasons babies need to be topped up, I'm doing that in quotations here, in our center in those first early days is when they have high levels of bilirubin. Bilirubin is a breakdown product from red blood cells, and it's not uncommon that babies have slightly elevated bilirubin levels after birth, as their livers are just starting to learn how to process bilirubin. And oftentimes, elevated bilirubin levels can be worsened by low intake as babies excrete or get rid of their bilirubin in their urine and their stools. So, adding in a little bit of extra colostrum or formula can help to treat their jaundice. So, jaundice is high bilirubin levels. So, you guessed it. If you have colostrum, you can offer that to the baby instead of formula. Now, they may need additional treatment, including phototherapy, but a detailed discussion around jaundice and hyperbilirubinemia is a great idea for another podcast.
So, for anyone who's had previous breast surgery and they've removed some of the breast tissue or they've cut the ducts leading from your glands to the nipple, you may also be at risk of having a bit more of a difficult time with breastfeeding and milk supply. So, practicing hand expression helps you to have extra colostrum on hand for your baby and also sets you up for success with the skill to help you optimize your milk production. The other thing is if your baby's been diagnosed with a physical difference in pregnancy, for example, a cleft lip or palate, it can be really challenging for them to breastfeed and to latch on the nipple effectively. So having those skills to hand express and having a way to get that food to them is really important. And then we can go on and on about the benefits of hand expression, but I think we've made our point.
Right? And like we said, that's not an exclusive list. There's so many great things, right?
Yeah. The other group that I think it's really important for are people who have PCOS.
Yes.
And that's kind of on the spectrum of the type 2
Diabetes.
diabetes and
And type
gestational
3
diabetes and type 3 diabetes.
Doesn't exist.
Yeah. And then the other group that we often forget about is there's actually really good evidence that women who are obese during puberty or who have large pendulous breasts, so those breasts that really hang down, they don't actually have the
As much
same
tissue.
amount of glandular tissue to produce milk. So starting off that hand expression can be really helpful for that group as well. Also, those people, any of the people that we've named above, having a consultation with a breastfeeding specialist prior to having your baby is super, super beneficial. So many communities have somebody that they can refer you to who has a medical expertise in those conditions and kind of supporting breastfeeding. So getting one before you even have your baby is super, super valuable.
Absolutely. You know, hand expression is such a simple and effective way to learn how to express breast milk. And did you know that actually a lot of studies show that it's more effective, it's as effective, if not more so effective than pumping? People find that hard to believe, but it's true, man.
Yeah.
You got remember Christina? She was like our best. I'm showing Alicia my hands here. Your most effective tool in breastfeeding is your hands.
Yeah. And the other thing that people recommend in those first few days to weeks, while you're kind of just, you're getting home and you're kind of starting to establish breast milk or breastfeeding, but still figuring out the latch, is having a little hand expression station that you can, every time you walk by, you just hand express into a container and you just leave it there. And then every 4 or 5 hours, you put it in the fridge. So somewhere that, whether it's in the bathroom after you've washed your hands, obviously, or, somewhere that you're walking by in your bedroom or something, that every time you go by, you just do a quick hand expression. And that, again, is that supply and demand. So it empties out your breast to trigger your body to produce more. And so it kind of is a way to set yourself up for kind of long-term success. Now, if you have a history of having copious amounts of milk, maybe don't do it.
I had that problem with my first, because I pumped so much in the first few days because he couldn't latch. I had like enough milk for twins. And another thing that is really good to know is how long you can let your colostrum or your milk sit out. And so the guidelines in Canada and the US are a little bit different. So here in Canada, we say up to 4 hours at room temperature. It can be in the fridge for up to a number of days.
Yeah.
And you can add room temperature to fridge temperature.
Correct.
There's all this like weirdness out there,
That'll
right?
be one for our myth busting podcast.
It makes no sense to me. And then in the freezer, if it's a standalone freezer, like it's not a fridge that you open with a freezer at the same time.
So deep freeze.
Deep freeze. Thank you, Alicia. You can leave it for up to a year. Yeah.
Awesome.
Yeah. So, hand expression helps you get comfortable and familiar with your breasts, allows you to collect your colostrum, your liquid gold that can be helpful in so many different circumstances in those early days. And just a reminder, check with your care provider. Generally speaking, it's safe, but we always recommend you ask your care provider before you start to practice hand expression.
And there's a great website, which is free, accessible to everybody, called firstdroplets.com, www.firstdroplets.com. We'll link it in the show notes. And they've got some great videos on actually how to do hand expression. Yeah. They've also got some great videos on how to latch your baby. So really good to get some education around that before you actually have your baby, because it gets for I'm going to say every first-time parent.
Mhm.
It gets overwhelming in those first few days or weeks
sure.
just trying to figure it out. It's the very rare person who does not have some challenges
Yeah.
starting off their infant feeding journey, whatever that looks like. So
Yeah.
awesome. Well, thanks so much for listening, everybody. That was super fun.
Yeah.
We've coined a new term, type 3 diabetes.
Oh, well, that's it for today, folks. Happy hand expressing.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.